From the start, my whole goal was to educate, not to try to convince someone to do it, it's to educate. As a mom, of course, I was doing my own neurofeedback because a dysregulated parent creates a dysregulated child and vice versa. The whole way that we speak in our home, the communication has opened. So it's all of the byproducts that have really changed our family dynamic.
Welcome, everybody, to Real Brain Talk. We're back again with another podcast. Dr. Guy, Dr. Ken, owners of BrainCore Neurofeedback, and we are welcoming a very special guest today, Sandra Murcott, one of our real power users of BrainCore. Hey, Sandra, how are you?
I am great. Thanks for having me today.
Yeah, we're really happy to have you. Why don't you introduce yourself to our audience and let everybody know, what you're all about, what you do.
Sure. Well, my name is Sandra Hooper Murcott. I am an educator by nature, and my master's degree is in brain-based education. So a lot of my training is under the teachings of Howard Gardner, which is the multiple intelligences and that different parts of the brain control different learning functions. And so when I found BrainCore Neurofeedback, looking for, as a parent for my son, which we'll go into kind of that journey, it really matched my education and my level of learning as far as how the brain works from the educational standpoint. We were coming out of the COVID era when I found this modality as well. And so it really was from the perspective of a parent looking for something for her child and a daughter looking for something to help my dad who had gone through a liver transplant. And so it's a little bit of a different pathway than you may hear from some of the providers, but I had a big need as far as not only a provider of neurofeedback, but a consumer of neurofeedback. And so that really was what started my journey.
Yeah. You know what? I think, Guy, we find a lot of times people get into this for really personal reasons. And then they take it from there and they expand. I mean, tell everybody how many offices?
We have 10 now in the Dallas area.
10, yeah, all in Texas, right?
Mm-hmm.
You got to remember, BrainCore was born out of a personal experience of my own, right? It was born out of my desire to help my autistic nephew, and that's really where it started back in 2009. Right. So it happens a lot. We see, we'll see clients that have been going through BrainCore. All of a sudden they're like, well, I want to do this too. Right. And next thing you know, they're opening an office just like you did, Sandra, and they're, flying with BrainCore.
Well, that's one of the best things about BrainCore is being able to be certified and to be trained by the best and be able to use the technology that you have given to be able to bring this to the masses. So, it's been a huge gift.
Yeah, it's amazing that you can take your personal interest in it and now have expanded it so exponentially to help so many people. Because, I mean, gosh, 10 offices, I can't imagine even what the numbers are like of lives that you're changing and families that you're changing on a daily basis. It's incredible.
Yeah, huge gift.
Are you seeing a lot of clients in your offices using home training, or most of them coming to your office to get trained?
We have 12 home units that we will send out to different people. So that is what we do to get our clients who are in different locales in the nation. But most of the people are coming in in office. So that's why we scaled the way that we did, because we figured we really needed to be neighborhood specific, because people were asking them to come in, especially if we have children coming in, we're asking them to come in twice a week. We don't want to take them out of school and we want to make it accessible for them. So that's kind of the idea of how we are scaling, and BrainCore makes it so easy to be able to do that in different locations. So that's been such a big blessing for us.
Tell everybody, so because you're different than some of the other, providers that we have who come from a healthcare background where they are working with, patients and clients on a daily basis. You come from an educational background, and now you're adapting and, are able, because this is such a great profession, that you have the ability to actually now work directly with people. Tell us how that's, how that shift is for you from going from the educational portion to now actually working with people.
Sure.
I am medically adjacent because I started my training in college in pre-med. So I went through the first 2 years pre-med, and I knew I wanted to work with children. So I was going to go either pediatrics. My dad is a doctor. He's an MD. and has worked his whole career in infectious disease and molds and mycotoxins. And so he was a Navy doctor as well. So I have always been around the medical community. And so I knew that I wanted to work with children, and my mom's a teacher and my dad is a doctor. So I started off pre-med and then went to the teacher route after organic chemistry. So that kind of shifted me over in one way or the other.
Yeah.
So when
organic chemistry gets a lot of people.
It does. Yes.
Tough one.
I took a shift in that direction, but I did have a lot of not a lot, because doctors go through far more as we know than I did. But I had that background of knowing that I really liked this area, and then went through the kind of unconventional education route of getting my graduate degree in a brain-based education. So it was a little bit different than just, the typical curriculum design or different things like that. So I've always had a spin to that, and have trained at the schools that I've been at in that area of like, how do we tailor a program, an educational program, to the needs of a child and their learning style and their brain and how it's functioning. So little did I know, I say that this kind of was a perfect storm of all things, because I'm an adoptive mom as well. And so we know that adopted kids, we got our son at birth, but there's an inherent level of trauma that happens with adopted children anyway, even if you're getting them straight from the hospital. And so we started to see that. So from a mom's perspective, I knew that I didn't want to introduce medication to him just because of background and what might have happened. And so we were looking for a more holistic approach to helping him with some of the things that we were seeing going on with him. And then at the same time, my dad was going through a liver transplant. And so I was primary caregiver. So I was back in that, again, medical adjacent role of being with hepatologists and just knee deep in all of the things that were going through him and his brain not being able to detoxify. And so being in the mold and mycotoxin realm, my husband was the CEO of this medical laboratory. So we didn't even know it, but all of this was so intertwined with what we're seeing with neurologically compromised patients that have mold exposure and all of these things. So when I found BrainCore, it was something that I very much stumbled upon, but very much feel like it was a part that was meant to be in our path, because it not only has helped our family, but it has really intertwined into what we do now. So we take a 4-pronged approach at Braintopia, because we know that we are only the functional piece of this, and that I know that my training only goes so far. And so we have enlisted metabolic doctors that work with metabolic. We have an environmental team that will help with molds and mycotoxins and seeing if someone is exposed to that, and then also a psychological team. So in one of our locations in Highland Village, we actually have a team of therapists that work with us, and we're in office with them. So they help us to be able to look at our brain maps and help with we don't diagnose, but will help with some of those more complex cases should we need some support in that area. So we know that we are only a very small part of this in the whole ecosystem of helping people.
Right. So you created a whole community of wellness around your wellness modality that you're using, and then all the offshoots of all the specialties that might need to be addressed during your wellness program. You just have resources for them to help as well.
So Sandra, what you've built is quite fascinating. It's so impressive that you were able to put so many different specialties together to help your communities at each of your 10 locations. My question though is, what's the typical type of client that comes into your office? Do you specialize in any particular presentation or age, like you specialize in kids, or what is your main client?
It's a great question. So when we started with mostly children. So I'm still an educator, so I still teach 4th grade. And so we really specialized in like the 8 to 11 or 8 to 12-year-olds that happened to be the age that my son was at the time. And so it just made sense that we were starting with him and starting for him. And so a lot of his friends were coming in. So they were having focus issues in school, or they would be having issues getting to sleep or staying asleep. We were seeing such a huge uptick in negative moods, and, just trying to understand how we were dealing with our feelings when we're coming out of COVID and all the uncertainty that was going on at the time. And so that was really where we started. But what happened is the parents were seeing how beneficial it was for their children and how their moods were improving and how they were able to get through the day without just feeling so, agitated all the time, that then the parents started to come in. And so moms would come in, and then dads would come in, and then siblings were coming in. And so we were just needing to to scale at that point. And the real turning point was with my own. I always like to say my family is my inspiration in this, because we had my little niece come in. She wasn't even 2 years old yet. And so it was a little risky to put her in, but I felt like if I'm going to use this modality on the people that I love most, which is my own family and my tiny little niece, who was, doing things like hitting her head and intentionally, and just communication was an issue, and her words weren't coming as easily as we were hoping. And we started her on just SMR Up, which is the greatest way to start and the safest way to start. The amount of, I will just tell you, her pediatrician, tomorrow, I'm going to his office at an open house to bring the knowledge of neurofeedback to his practice, because he saw such change in her in 2 years. She's been doing it for 2 years now. And the change that he has seen in her has made him want to bring this to the rest of his clientele. And that's what we're seeing. It's just, I call it mom to mom marketing. It's like one mom sees this working, and then they tell another mom, and they tell another mom. And I just happen to be the first mom that told everyone about it. And so
that's great. And the moms are like, well, I want to do it too.
Right.
Yeah.
They are. Yeah. Because we say a dysregulated parent is going to cause a dysregulated child. So
absolutely.
Yeah.
So this open house that you're going to be doing, tell me a little more about it. Like, are you doing like a formal presentation? Who's going to be there? Does he have his patients coming in, or is he just asking you to educate his office?
It's more, so I take everything through, again, being an educator, from the start, my whole goal was to educate, and not to sell, not to try to convince someone to do it. It's to educate. And so the first, like my social media post for probably the first 3 months that we were open was taking BrainCore's website and screenshotting different things and just putting it on the website. Like just literally taking everything that you guys had done and putting it on the website. So that's what I do when I go out to any locations. Like yesterday, we went and did a lunch and learn for a chiropractic office. And my feeling was I need them to know what neurofeedback is and the positive nature of neurofeedback, so that when someone asks about it, they don't just say, oh yeah, that's something that maybe, maybe it's up and coming now, or maybe it's something that you should look into. But no, let's educate about what it is so that people feel comfortable and doctors feel comfortable recommending their clientele. So tomorrow when I go to this pediatric office, he's more bent toward a holistic, approach to pediatrics. And so that's what I'm going to do. I'm going to go and tell, my little niece's story and tell the stories that we've seen of other children, and just tell about dysregulation and gut health. And he knows all these things. He's already doing these things, but being able to let parents know that there's an option, that if they were like me and just didn't want to introduce their children to meds, we're not anti-med. We know that they serve a purpose, but if they want another solution, there is one out there. And so that's how we have grown and will continue to grow, is just through the education piece.
I mean, I would imagine, Guy, that this is music to your ears, because
I was just going to say it.
You created BrainCore with education in mind, and it's the backbone of everything that you do.
Yeah.
Is about education. So the fact that this sort of combined into educator, it's
the BrainCore providers that are out there. Listen to it. I talk about doing lectures all the time, because my philosophy on the whole thing is I'm not selling anything. I just want you to get the information, and then you make an informed decision if it's for you or not. And it might not be for you. Maybe you're not ready for it. Maybe you want to take the pill and get the quick response, but that pill is going to lead to other issues and more problems
and more pills.
And more pills. So when you're ready to get to the bottom of the problem, then come see me and we'll do some neurofeedback and we'll get you fixed.
And I will say that I think the most dynamic of our BrainCore providers are ones who are really focused on educating, and education really is the key, because when it makes sense to you, it's almost like, why wouldn't I do this? Because it makes so much sense. But if you just say it in a way that doesn't make sense, it's different. It's like a very different paradigm to what we're used to in allopathic medicine. This is not that. It's a wellness modality. It's a learning modality. When you can teach a brain, and in your case, a lot of young brains, but there's also old brains, and you can, you can teach old brains new tricks. You just have to have the right, fundamentals and how to do it. So Sandra, why don't you tell us some of the amazing success stories that you've had? I'm sure with so many that you've been able to reach, there's got to be some pretty impressive stories.
Sure. Yeah. So 3 come to mind right off the bat. The first is going to be my little niece. So I say this, and I'm careful to not tell the whole story because these are their stories to tell. I don't want this to, come out when she's an adult. But the biggest thing was that at not even 2 years old, we were looking down potentially diagnoses that were going to be put on her that would have been lifetime long diagnoses. That's why her parents so wisely took a different approach, and so brought her in at an early age and very early on in our practice, and really trusted the process, which I applaud them for. And she is the number one. So what happened is, again, we started her at SMR Up. We could not map her effectively because she would not do the eyes closed portion. Obviously, she was not even 2 years old. We sat her in a high chair. And it wasn't the best of ideas, but we let her eat snacks during it because we could keep her still if she would eat snacks. And so little by little, we were able to get her to the point where we were able to map. Now we can map her both eyes closed and eyes open. She's 4.
She's 4 now.
She just turned
now?
4. Mm-hmm. Okay. And after about 10 sessions at SMR Up, she counted 1 to 10, and we got it on video, which was a huge win for us. And more, she stopped hitting her head. She stopped, and she was just doing these things because she couldn't communicate. And so as we were able to open those pathways and get that dysregulation more under control, then we were able to see her able to communicate better, which then led to a lot of the emotional dysregulation that was happening. It started to wane. And so that I would say she's probably one of our biggest success stories, just because early intervention with this modality showed such huge life-changing results for her. And so her sister came on, and then the whole group, I'm telling you, my whole family is a part of this. And so it's been a huge, and the prophet is never welcome in their own hometown. So to get your family on board shows that there's something to this. So especially my family. Another success story is my son. So we were seeing a lot of when we were going down this path, I was looking actually to get some kind of diagnosis for him, whether it's ADHD, whether it was whatever, just because I wanted answers. I knew I wasn't going to do what the next step was of medicine with ADHD, but I just wanted to know. I wanted to know is
how old was he at the time?
He was 9. Okay. And so when we went through the whole ADHD process of evaluation, there were 3 subjective measures that were taken: the pediatrician, which we saw once a year, the teacher, which was me, because I was his teacher at the time, and the parent, which was also me. So 2/3 of this subjective evaluation was me. I went in and they said, well, there's nothing wrong with him. And I said, well, thank you for saying that, but we're seeing dysregulation. Even if we wanted to, we couldn't get a diagnosis that would have helped us in any way. And so we went this path. He had all kinds of inflammation, and we saw within 20 sessions that inflammation go away. Now, we did make some changes to his diet because we know neurofeedback is not what took the inflammation away. But we were able to get the data that came from that QEEG brain map to know what steps to take, whether it was a detox, whether it was, all of these things, because we know this is multifaceted. It's not one thing. You don't only do neurofeedback. You do all of the other things around it to make sure that you are healing through gut and everything else. And so we saw him completely change and go from a very emotional child who was, throwing himself on the ground to a very logical child who now can talk through things. His path just completely changed. And so me as a mom, of course, I was doing my own neurofeedback because a dysregulated parent creates a dysregulated child and vice versa. And so the whole way that we speak in our home, much to my husband's, elation, the yelling has stopped, the communication has opened. So it's all of the byproducts that happen around that have really changed our family dynamic. So I can speak to that. The other case that comes to mind is a good one because it actually started with a neurologist. So we had a 15-year-old who came into our office because she was having seizures, but they could not, the neurologist actually sent her to us because they said, we have done every test. We have done everything that we can do. We have put her on seizure medicine. None of this is working. We don't think this is actually, we think this is more an emotional component to this. We think this is trauma. She was a gymnast. And so she had some injury, but he said, we've done everything that we can do. And she's not responding to anything. She would have like 4 or 5 big seizures where she would just pass out and fall on the ground. The nurse and school would have to come get her. This poor kid was a freshman in high school and she was miserable because she was so embarrassed about what was happening every day in class. Well, she did a full protocol of 30 sessions and she went from having 4 or 5 of these events per day to having 1 a week. And then they just did not happen anymore. And I was like, I wish we could open the brain and take a video of what's going on. Like that would be such education that I would love to be able to show people. We can't, but we could take the data that we're getting from the amazing brain core technology and show her mom through that, and then remapping and the, subjective data of the cognitive emotional checklist and her symptom tracker, and show how her brain was actually healing. So this was not just an accident. We had all the data that we needed to show over 4 months how her brain was progressing. And that's all based on the technology. So I think that's another thing that's really great about BrainCore is it gives us all the technology. And once we are trained, which you guys do such a great job doing, once we are trained and certified in how to read the tools that are in front of us, we can educate people about what is really going on. And so it kind of gives that glimpse into the brain that we couldn't give otherwise.
Yeah. And just for the listeners, I'll give just a little background as far as the BrainCore approach. It's a very functional approach, non-diagnostic, as you mentioned, but we look at the bio and the psycho and the social factors that surround everybody. And we use the neurofeedback as a tool to help them re-regulate and learn how to regulate themselves better. So it is a very general wellness program designed around, all the biopsychosocial factors that go into creating stress in people's lives. And Guy, I don't know, maybe you want to give the audience a little background on seizures and neurofeedback and how they tie together.
You're talking about with Sterman studies?
Yeah, and how how neurofeedback developed primarily from seizure activity.
Yeah, it is one of the primary things that were first addressed with neurofeedback, and it was done by a researcher by the name of Barry Sterman out of UCLA at the time. And what he was doing is he was doing experiments on cats, and he had a cat hooked up to an EEG. He was kind of reproducing Pavlov's experiments. He wanted to teach the cat every time you hit this little lever, you're going to get a little bit of milk. And so the cat would learn how to do that. And then the next part of the experiment was we're going to go ahead and introduce a tone. And as long as that tone was playing, the cat could hit the lever all he wanted. He wasn't getting anything. But when the tone stopped, the cat could hit the lever and get the milk. So they were teaching the cat to wait for the tone to stop. And what happened was, as they were doing that, they noticed a brainwave that they had never seen before on the EEG. And they called it SMR. And then they went to the next step of the experiment and they said, all right, we're going to give you some milk, cat, every time you produce SMR in your brain. And so it was no more a lever or anything. The cat would just sit there. And if the cat produced SMR, the cat would get milk. So the cat was basically learning how to produce more SMR in the brain. And then the best part of the experiment is that it wasn't even this experiment. It was the second experiment that they did where they basically were studying the effects of methylhydrazine, which is rocket fuel, on astronauts. And so they asked Sterman to do these experiments with cats. And what Sterman did was he was injecting cats with methylhydrazine. And almost all the cats went into seizure, except for the cats that had been trained on how to increase their SMR. So the bottom line was that he was able to demonstrate that if you can train the brain to increase and produce higher levels of SMR, you could make it more resistant to seizures. And obviously that led to the human part of this, where they started doing SMR uptraining on people with seizure disorders, and they noticed a 70% reduction in the severity and the frequency of the seizures. So I know that was a long explanation, but to me, that's amazing.
And it ties into, Sandra had mentioned several times doing SMR up at CZ, and now maybe the audience understands a little bit more what that is. It's
how powerful it is.
This protocol has been around for over 60 years, and it's amazing, life-changing.
Yeah. So, wow, those are some great stories, Sandra. I really appreciate you sharing those with us. Do you mind sharing with us, like, how many clients you see in the 10 offices each week?
Sure.
Well, you don't have to if you don't want to, but I'm
No,
just
sure.
curious. 10
No, I'm
offices is
happy
a
to.
lot of
It's
offices.
a lot.
Well, within our offices as well, there's probably half of them that just are one seat, which means we just have one chair, one system. We rent a location, in a chiropractor's office or different things like that. Those are becoming fewer and far between because we need families are wanting to come in. So with those, we see between probably 20 and 30 sessions per week in a one chair center. But our flagship, which is in Frisco, Texas, which is like right where the Cowboys train and all that, we have 4 treatment rooms or four training rooms. And so we probably see about 100 to 120 sessions a week in this location. So we're hopping. I mean, and it is.
Yeah. That's a lot of sessions.
It is.
You're changing a lot of lives. That's awesome. You really are.
And then on top of that, you have the home training units out on site where you're not even spending any extra time or really it's minimal amount of time for you, but you're able to help that many more people.
Absolutely. And we could even have more home units out if we could figure out relationships with other BrainCore providers for the mapping process. So that's an important part. All of our BrainCore providers, let's figure out how to cross-pollinate, so to speak, so that we can get more and more people on these home units. Because it's definitely a need that people, want. So
I heard you mention the Cowboys training camp.
Mm-hmm.
And I know you're an educator. Why don't you go educate them on neurofeedback and peak performance? And they need it, especially, I think you should put Jerry Jones on it first.
For real. Yes. Well,
I'm a Giants fan. I'm not sure I want them being so much better.
That's right. That is true. Well, it's interesting that you say that because one of the education pieces that I've really been working on and working with our other partners with is the education piece of where does neurofeedback fit in the whole ecosystem of EMDR and TMS and all of that, because the NFL does, I don't know if I'm saying too much here, but the NFL actually covers TMS as a part of their athletes after they retire, what they can get as far as that. And so it's been a big education process and neurofeedback is going to get there. Like we are going to be a part of that, but it's educating and getting people understanding the difference and the whole ecosystem of where does neurofeedback fit in with EMDR and with TMS? Because that's what we always train or teach people is like, there's not a competition with neurofeedback. Neurofeedback makes everything else better. So we do the functional work and get the hard drive of the brain working and get it in operative condition and then send them back out to their other modalities for maybe the long haul. So there's no one that should look at any BrainCore provider as a competition. All of us are, doing something to help them be that much better. So that's what we're doing. Getting into the world of sports is definitely something here in Dallas that will happen. We've just been so busy with our younger clients and our families that we haven't even had the time to get into that yet, but it's definitely on the horizon and it'll come through in a big way.
Just do me a favor and don't train the Houston Astros because I'm a Yankee fan and I do not.
Hey, we're Ranger fans. I'm a Ranger and a Padre fan.
Okay.
So no, we don't want the Houston Astros to do well. No. Sorry, Houston people. Sorry.
That's funny. Especially in the sports environment, because as you mentioned, especially in football, because there, talk about fitting it in. It can be in any part of a professional athlete. I mean, there's peak performance to help them perform better on the field. With football, there's a lot of impact. So there's a lot of injury that can occur to help them stay healthy during their playing career. And then post-career, there's a lot to, I guess, improve and maintain after they've put themselves through this very arduous physical activity. So it can fit in any one of those areas.
Absolutely. Well, and we have seen concussion, like we could have a whole podcast just on concussion, especially in this area with Texas football being so huge. But we have seen, I won't say which professional athlete, but a prominent professional athlete in the Dallas area who was having so many concussions that the blood flow was such a problem through his brain that his eyes were really bloodshot. And he was going on TV and did not want that to be forward facing. So there's so many different areas that this corresponds and so many different ways that this is such a big benefit to people. And what I love about BrainCore is that it offers this to the masses. I keep saying that. So it is hard. People will call us and say, do you have a 6-month waiting list? And I'm like, no. But they will say that there's other places that they're looking for, and they do have this 6-month waiting list. We are so well trained, and a series of consistent training. I mean, I know what our leadership team comes out to Hilton Head at least twice a year. We'll go in October, and we were there last April. So, it's an ongoing training process as well, which is really important for us, and making sure that everyone who works for us is well trained and certified.
Yeah, thank you for saying that. I mean, we do have we actually have a training coming up next week with a new class of providers, and it's always now a mix of different types of professionals, or people like yourself who just are really passionate about this type of work. Obviously, our training is the same for everybody. We don't differentiate one from another, but it's really a great community of providers. The guy created this company to be that way, so that everybody can kind of join together and help each other rather than be competitive. So it's one of the things I absolutely love about the company. So
yeah, Sandra, what you verbalized was the embodiment of what I was trying to create back in 2009, 2010. I wanted a family of neurofeedback providers that work together for the benefit of basically humanity, for the benefit of everyone's brains, everyone, in everyone's communities. And I knew neurofeedback was a way to do that. So thanks for sharing that, because that makes me feel good.
And the reason that it is so global in its ability to help so many different things is because it's addressing learning of the central nervous system, and the central nervous system controls and coordinates so much that, that's the place to make change, to make that change all through the body.
Yeah, to affect so many different things.
Absolutely. Yep. And we're seeing, I feel like I'm on the front lines. The reason a lot of people will say, well, with this kind of growth in your company, why are you still teaching? And I ask myself that every day. But the answer is that I'm on the front lines still. And so I can see what the need is in the educational community with these kids that are every single day, because these kids are going to be the next adults, obviously. And so if we can get them regulated now and get them into more organized patterns and more logical thinking and more just out of the emotional and into the regulated, then we have that much more benefit for the future. And so that's why I continue to teach. That is why I continue to be in that setting and go to work. And that's why I'm so passionate about training, our staff around really client care and making sure that we're educating everyone about what their sessions look like and what their brain is doing, so that we can, really truly impact the next generation. And that is not something that we say lightly.
Okay, Sandra, we're gonna go ahead and wrap it up, but we want to thank you for being here and for sharing with us. It's been a wonderful experience for me to hear the stories that you've told, and to see how successful you've been, having 10 Brain Core offices. I'm so impressed with that. So I want to just thank you once again for being here, and I hope you'll take us up on an invitation to come back. We'd love to see you again and talk more about your experiences and how you're bringing neurofeedback to the world, really. So Absolutely. Thanks again, Sandra.
I'd come back anytime. Thanks so much.